Hi, I'm Sarah Bruce and welcome to EHI TV. I'm joined by Sue Gunn, who's the Head of Clinical and Business Applications at West Hertfordshire Hospitals NHS Trust, and they've just signed a deal with CareFX for their portal. Here's Sue to tell us a bit more.
Yeah.
So Sue, why have you actually signed this deal and what is it that you're looking to achieve?
We signed the deal because I think we went to a conference 18 months, 2 years ago, and Di Nixon was presenting on behalf of Adam Brooks, and we felt that it brought together everything that we'd been building in the Trust into one view, which would really help clinicians manage their patients and give high quality care. We researched quite hard all the various companies that did similar things, but in the end we were really impressed with CareFX, both their outfit, the way they relate to customers, but also the fact that it was using our existing systems in a on a real-time basis, and we didn't need to buy another layer or data warehouse or anything else of that nature. So that's why we chose them.
And what systems have you got in place and what will it actually be bringing together to display?
It'll be bringing together our PAS system, the clinical system we use, which is Infoflex, PACS, results report, order comms, results reporting. We hope to bring on theatre man and pharmacy. Generally, all the key clinical applications that help clinicians in their decision making.
And you obviously started looking at this, as you say, a couple of years ago.
Yeah.
But what's actually spurred you on to sign the deal now? There's obviously been some changes around the national programme, and portals seem to be one of the ways forward for quite a few trusts.
Yeah.
Why have you not gone with the big bang implementation of an EPR and that kind of thing?
Well, obviously, funding is one thing. The resource we have within the Trust is another. But also, you know, we wanted to make best use of all the work we've currently done in the Trust. And we saw the portal, it's really the culmination of 15 years' work I've been doing with clinicians to give them something back, to give them something that's real. And really that's why we went with that approach. Our board were very keen for us to do so. And even in these austere times, they've actually been supportive of us doing the deal with CareFX. Many other projects have been put on the back burner, but this was a must-do for our Trust because we're there in clinical informatics to help clinicians primarily, because that's our business, looking after patients.
And what about the longer-term strategy? Presumably you've invested in this so that you don't have to roll out Lorenzo in the future. Is that correct?
Yes, I mean, the problem for us is that, you know, we should have implemented Lorenzo 2 or 3 years ago. Since then, we as a Trust have moved on, and Lorenzo at the moment would be a retrograde step. So what we're doing is kind of we're watching the space to see how they do develop it, but also looking at other ways of providing the information that's currently provided by our PAS, because we've got so many now different systems brought together in a portal. Do we need a PAS, or do we just need a master patient index? So they're the things that we're currently looking at. We might have to go to a PAS and we might not. The market's moving on so fast that it may be Lorenzo just can't catch up with where we want to be.
So it sounds like quite a busy time. How's the rollout going? Have you started rolling out, or
No,
when's the go live?
We've had our first, we've had meetings with CareFX, and our first project meeting is in December. But over the next few months, we've got several big programs. We've got to put in a new pathology system, bed management, order comms. But we hope to have it rolled out by the end of this financial year. It apparently isn't a long deployment. All our clinicians are very on board with it. The company are helping us a great deal, and I'm sure we can move forward fairly quickly.
Okay, thank you very much, Sue.
Okay, thank you. Bye-bye.